Welcome back inside Arizona Daily Mix. November is National Diabetes Awareness Month, and here to talk about diabetic eye disease, something that a lot of Americans are living with, is Dr. Neal Palejwala, and he is a vitrio retinal surgeon.
Vitrio
retinal surgeon with the Retinal Consultants of Arizona. Thank you so much for being here. This is a lot of valuable information. So many people are living with diabetes, and it's a pretty serious stage when it becomes and affects your eye, correct?
Yeah, absolutely. You know, diabetic eye disease is one of the major things that affects the quality of life of patients with diabetes. It causes a lot of doctor's visits, a lot of different medical care, and can be a blinding disease if not treated early and quickly.
Well, we're in good hands because apparently Arizona, the Retinal Consultants of Arizona, have opened the nation's largest treatment facility and surgical facility right here in Arizona. So what does that mean for us as a whole?
Yeah, we're really excited about it. At our practice, Retinal Consultants of Arizona, we have offices all over the state, about 30 plus offices throughout the state, but we're really excited about this one because this is one of our largest practices. It's on 29th Avenue and Greenway, right off the I-17, and it's the largest freestanding medical retina-specific care center. It's going to have an ambulatory surgery center on the top floor, and it really allows us to provide kind of the world-class care to our patients here in Arizona. And so we're really excited about it. It's a great building with a lot of space, and we have all our diagnostic equipment there, next generation equipment, as well as all our clinical research is out of that building as well.
And it's one of those things that people take for granted, because a lot of times if you have the severity of the disease affecting your eye, you have to be sent out of state to get it treated. But right now you can stay right in your own backyard and have the doctors take care of you here in the comfort of your own area. So when it comes to this type of disease, I know you guys are doing some amazing things, and because it is National Diabetes Awareness Month, you want to bring awareness, and you're having your first annual Diabetic Awareness Support Group. So how does that affect the families?
So that's really important because diabetes is more than just a disease to the patient. It's a disease of the whole family. You know, everyone needs to participate in helping the patient achieve, you know, what they can achieve in terms of blood sugar control, and also providing them help in getting to their appointments and treatments and taking their medicines. So it really does affect the entire family. And a lot of times when you're in the doctor's office, whether you're in the primary care or the eye doctor or any specialist, things can go by really quick, and patients have a tendency to kind of forget what questions they might have asked, or they feel uncomfortable asking because everything's moving fast. And with this support group, we have, you know, it's a Saturday, it's about a 2-hour event, and it's really for the patient to get FaceTime with their doctors. And we're going to have retina specialists there, as well as a podiatrist, an endocrinologist, a nutritionist, a dietitian. And so really it's, you know, it's one of the few opportunities where someone can have all their doctors in one room having a conversation with them and kind of learning what's best to help them, you know, maintain their quality of life, control their disease. And I think it's a really great event that we're going to be having in a couple weeks.
Fantastic, absolutely fantastic. And one thing that I did notice, that you said you're going to have a dietitian and a nutritionist there, which is so vital right now because we're going into the holiday season, and that's probably one of the hardest things to do, is to try to maintain your sugar and eat the right food. So this is the time for them to go and get those questions answered, so they won't be tempted when they go to a holiday party or someone's house for Thanksgiving or Christmas, correct?
Exactly. And one of the things we know about, especially with diabetic eye disease, is not a lot of the damage happens when you have sugars that fluctuate a lot. So when when you cheat a little bit and your sugars go up and down, and you have a couple months of that, that can really cause a toll on the eye disease.
Oh my goodness. What are some of the questions that people should be asking if they're just now taking care of someone for the first time who is dealing with this?
I think the most important thing to understand about especially diabetic eye disease is that, you know, what the long-term outcome is, what the treatment burden is going to be, how often the visits need to be. Because a lot of people with diabetic eye disease, it's a slowly treated disease. It's not going in and, you know, you have a problem and the next day you're 100% better. You know, just like diabetes, it's a chronic condition that needs needs follow-up over the years. And so I think that's one of the things that patients get kind of disheartened about when they have to have multiple visits and things aren't changing. And so I think it's really important for the whole family and the patients to understand exactly what goes on in diabetes care and what we're looking at and why we are following them so closely.
You were fantastic, a wealth of information, and we could use so much more time with you, so thank you for being here. This is Dr. Neal Palejwala. If you'd like more information, retinalconsultantsaz.com is the place to go. And we'll be back with more because we're going to tell you what we have coming up on Thursday's show. Thanks again. You were fantastic.